I can certainly understand how people may be concerned on a day like this. We've heard about new guidance and you look at the map and you see the numbers and hear about more cases. But let me tell you about a couple of things that have not changed. What has not changed is that the vaccines that we have are still extraordinarily effective at saving lives and preventing severe illness. That is good news, and it represents progress that we've made in the last 6 months, and we're not losing that progress. What has changed is Delta and what we learned in recent days about the Delta variant. We know that variant is highly transmissible, the most transmissible we've seen to date. We know that cases have more than quadrupled in recent weeks. But what we learned in recent days was that people who experience breakthrough infections with Delta are actually more able to transmit the infection to others compared to people who had breakthrough infections with other versions of COVID-19, like the Alpha variant. And it is that last piece in particular that was a really important linchpin here in the recommendation the CDC made yesterday. I know, we don't want to go back to wearing masks again, but these masks are a layer of protection that will help us prevent spread at a time where we are seeing cases rise. So the people that we're most concerned about are the unvaccinated. For example, if you happen to have a lot of interaction with folks who are unvaccinated, let's say you're a parent like me who has young children at home who are not vaccinated, that's a circumstance where being extra cautious and wearing that mask, even if you are fully vaccinated, wearing it outside when you're in indoor public locations is an extra step to protecting those at home. I want to emphasize, though, that if you are vaccinated, the likelihood of having a breakthrough infection is still low because, again, the vaccines are working to help prevent infection, particularly serious infection. But in the unusual event that a breakthrough does happen, we know transmission can take place. So that's why, especially when you have a lot of virus circulating in the community, it's important to take that extra step, go that extra mile, wear that mask in indoor settings outside the house so you don't contribute to the transmission. Follow the CDC recommendations. What they are advising, especially for people like parents who have those who are unvaccinated at home, is to be vigilant about wearing masks in indoor settings outside the house so that you don't have to wear masks in the house with your children. I'll tell you, as a parent, that's something that I do. I happen to be spending a lot of time in an area that has a high degree of transmission. So when I go outside, to the grocery store or to other indoor places outside my house, I wear a mask. And so when I come home with my children, I don't have to wear a mask because I am more confident that I'm not exposed, my children are at lower risk. So that's the approach that I take. I know that many parents out there take. And finally, I just want to say that as far as schools are concerned, and as a parent who's got 2 kids who are going to be going to school in the fall, I just want to emphasize that the layers of precaution that the CDC articulated a couple of weeks ago that are important for schools are even more important now. Making sure that our kids are masked regardless of their vaccination status, making sure that we are improving ventilation in classrooms, keeping kids home when they're sick, using testing as a way to screen out any potential infections. These layers matter, and implementing them is a key part of how we're going to protect our kids and keep them in school. The topic of boosters is a really important one that we've been very focused on, especially in recent months. What we're going to use to determine whether a booster is needed is actually data from a variety of sources. What Pfizer provided, data from the company itself, is one source, but it's not the only source. We are also following cohorts or groups of individuals in various settings, nursing homes, medical professionals, and others, to see if there is a decline in immunity and an increase in breakthrough rates. And if there is, as soon as we see that we will make a recommendation on boosters. And the good news is we will have the supply available to provide that to the public. But at this point, based on the data that we've seen, the collective data, the recommendation is not to have boosters implemented so far. But if that changes, and when that changes, we will absolutely let the public know. The good news is, one of the silver linings is in the areas in the country, Andrea, that have been hardest hit by Delta, we are actually seeing the pace of vaccinations increase. In fact, they're outpacing the national average. And I think that's in part because many people are seeing what's happening in their communities and are recognizing Delta is different. It's more transmissible, and it's hitting more people in our communities. So we've got to get vaccinated. We've just got to continue to press forward and make sure those rates continue to go up. The faster they do, the more we'll be able to get back to our way of life, to save lives, and ultimately get rid of our masks as well.